talking with Dr. McCarthy. He's a board certified surgeon and he works at Capital Vets. Capital Vets is a specialty clinic here in Jacksonville, Florida, and we're gonna get to know him better. How you doing?
I'm doing really well, Carlos. Thank you so much for inviting me on.
Thanks for coming.
Yeah, definitely.
So, been doing some research on you, and you've been all over the place. You've been in University of Tennessee, Louisiana, Michigan, South Florida, and now you're in Jacksonville, Florida.
Yes, sir.
Tell us, how did this all happen? All this movement? What were you trying to accomplish?
You know, that's a great question. And looking back on it, sometimes I think it's God's will, So I went to veterinary school at the University of Tennessee, graduated in 2015, and I decided to pursue specialty surgery. I did a specialty rotation in orthopedic surgery my second year of vet school. Absolutely fell in love with all the equipment, the saws, the fractures, everything you could think of that has to do with surgery I was into. And since school, I applied for a rotating internship. As anyone that's going into specialty practice, most residencies generally require this. And so I matched at Auburn and did a rotating internship there. Throughout each step, generally the goal is to get accepted into a residency, and I didn't get accepted for a couple of years, and those are actually opportunities looking back, opportunities where I could apply for different internships. So I applied to Coral Springs Animal Hospital, worked with 2 surgeons there, really refined my skills as becoming a surgeon in training, learned about more in-depth anatomy, how to manage emergency cases in a surgical setting. I really learned about doing surgery, solo, and I had that support system on the backside to help out with that. So it's good give and take.
When they say you're board certified, explain how do you become board certified? What does that mean?
So generally residency ranges program to program between 3 and 4 years. And after you finish your residency, you're considered residency trained. And after you finish your residency, you then sit for a board exam. And the board exam is administered, in my case, through the DACVS, or Diplomat, or the College of American Veterinary Surgeons. And that college administers an exam. It's a pretty rigorous 2-day exam. So, for example, some of the information required that you're going to be tested on includes about 2,500 pages of 2 textbooks that are chock full of surgery facts and information, as well as at least 5 years of journal articles. And
wow. You don't have to do a surgery though, it's just testing.
Previously, you did have to complete some tasks, but that has, as time has kind of evolved, and especially with COVID, in the event of COVID, they were limiting in-person interactions, so they actually had transferred to more of an online system now through a testing center. Lo and behold, it is still challenging.
Yeah,
and
a
lot of
that sounds complicated.
It's pretty complicated. I do thank God that He brought me through that. I went through some challenges of my own as my dad had passed away about a month and a half right before our exam, and for whatever reason I was able to identify about like 75% of the journal articles and everything, so I was very, very thankful. I was on my knees, honestly, when I got the results.
Yeah, that just made you stronger, huh?
It did, for sure. But so once you pass your boards, then you become board certified and you get the credentials, and mine is DACVS SA, which stands for small animal.
So now you have this new title. What did you do then?
I hugged my wife and I almost cried. So honestly, on a day-to-day basis, nothing, my practice doesn't really change, but I in that process of sitting for boards, I applied and got a job through Capital Vet Specialists here in Jacksonville. So I've been working already since August of 2022. And then I took my boards in February of 2023. So I'd already been employed, I've been cutting cases, I've been seeing cases on my own.
So some of your, because you've also been published.
Yes, sir.
Could you explain to us, how do you publish? How do you get published? How does that work?
You know, the publication process, it always starts with an idea. And so an idea can be a problem that you identify, it can be a question that's out there. And honestly, it's not that hard to get published. I mean, it is rigorous work, don't get me wrong, but it's just taking that next step. It's getting your ideas down on paper, coming up with materials and methods of how you want to try to answer a question. And once you kind of go through those processes, then you may do an experimental project.
This was during residency that you got published?
It was kind of during vet school and then throughout my internships and residency. Yeah, so I had a couple of
So you had like an advisor, you presented the study and he guided you.
Yes,
and
sir.
you had to have certain resources, because there's one you did with a 3D printer where you took cadavers and you saw if the 3D printed guides were better than just doing it eyeball.
Yes, sir. Yeah. Exactly. That's exactly right. So at LSU, when I was in my residency, they offered a specific program that, for residents you could apply for, and then they would offer you a scholarship, like a research grant that you could apply then to, whether it's secure funds for cadavers or to purchase specific software you need to do stats, or for whatever resources you may need. For my case, it was mostly to buy 3D printer filament and to ensure that we had,
So LSU had a printer.
LSU had it. So that's a great question. So my mentor, Alberto Hines, he's from Spain. And he is very into 3D printing. So we paired up really well, had a good mutual commonality. He had about 4 or 5 3D printers in his lab.
He had 4 or 5?
Yeah.
That's great.
Yeah, I walked in and I was like, oh man.
That's great.
Yeah, we don't have to do a whole lot here. And
so from your study, it seems the CT was connected to the 3D printer, and then the data from the CT went to the printer somehow.
Exactly. So through we call it a segmentation process. So we can CT a patient. From the CT, I can develop a segmentation. Segmentation is essentially a 3D model of whatever you 3D print or whatever you CT. So if you CT a pelvis, let's say we want to print a pelvis. So we can CT a pelvis. That information from the CT goes on to a computer. I can basically model out the pelvis, outline it, and bring that model into software that creates what's called an STL file. That STL file contains all the code that the 3D printer prints. So it tells you all the X, Y, and Z axis of where the printer needs to lay the print filament. And it's actually a very streamlined process to get it done, and it's just it's really cool technology. It's probably been out for about 20 years now, but at this point they have free open access software, so really anyone in the world can 3D print and build a model. One of the programs I use is called Tinkercad, and you can actually go on to Tinkercad and build things and create an STL file out of it without even needing a CT. So it makes things very affordable.
So is there any real world application to these printers?
It's a great, I think there is quite a bit of application. So as an orthopedic surgeon, we sometimes get presented with really complex crooked legs, you could say, or we call them angular limb deformities. And sometimes we just want a better understanding of what's going on in the bone. So we can 3D print the bone. We can actually practice some theoretical surgeries that we would do on the bone and see how that angle is corrected of if it's a femur or if it's a tibia. We can see what affects a rotation or specific rotation, actually practice the surgery on it so that when we go into the patient, that surgery is more seamless.
You're able to do the surgery before.
Exactly. We have more of a roadmap. We have more, more of an understanding of what needs to happen.
Yeah, this is sort of like Terminator stuff. The movie Terminator.
Yeah, you could say
Tell
that.
us about, are robots going to be able to do surgeries in the future?
I think ultimately it comes down to cost, in most things. And at Cornell University, they have implemented a robot to perform gastropexies, so laparoscopic gastropexies. And I believe that robot was donated to the college. So I think as time goes on, I think there will be a lower cost of robotics. However that looks, I think it could be something that we could implement. I know another colleague of mine has a robotic arm that he uses during surgery to drill specific holes or to actually hold the guide for the drill so that he knows it's exactly in the right spot, and then he can just drill the hole through the guide.
You said there were some glasses too that had
it's more theoretical. So I know in humans there's things like augmented reality, especially neurosurgeons will use augmented reality to basically have a heads-up display or some kind of display on glasses of MRIs. If they're doing brain surgery, they can see in real world different coordinates and like exactly where they are in the brain tissue. To if they need to remove a brain tumor, they know exactly where to dissect it out and everything. And I think that, as time goes on, we may be able to implement these ideas in the veterinary field, and it just takes the right person with the outside of the box kind of thinking.
Yeah, that would be interesting.
Yeah.
So Sunday is your big day. You're going to talk about gallbladder surgeries.
Yes, sir.
Wound healing.
Yeah, so as a veterinarian, my goal is sort of always help people. And so, whether that's teaching the local community things that I learned, just bringing a hometown experience to an owner, trying to comfort their concerns, just want to be able to sit down and have a conversation. So, pretty dependable veterinary care. So we're open 24/7. We have a board certified critical care department that, when we have patients that are really, really sick coming in, you just sometimes need that extra hand in the back pocket that really is involved with, fluid rates and blood transfusions and nutrition and everything like that. So critical care covers a lot of those environments. I myself, being in surgery, we do things like orthopedic surgery, neurologic surgery, advanced soft tissue cases. We heal things or we help correct cruciate tears, so by performing TPLO surgery to give a dog a stable knee, all the way to being able to fix complex vascular anomalies in the chest and things like that.
Yeah, that's great. That's all in house.
It's
you
all
have
in-house.
You call it polytrauma, right? An animal
Polytrauma.
with multiple issues.
Mm-hmm.
You have your criticalist, your
Mm-hmm.
internist, your surgeon. They all work together.
Yeah, so the polytrauma cases can be pretty challenging. So if we have a patient that comes in with multiple fractures of 2 to 3 limbs or something like that, then they usually require advanced pain management, wound care sometimes. Ensuring that just that all around patient care is excellent, and usually critical care is helpful with that. And sometimes they have to be just, we need more hands. So, sometimes just the nursing care. I created MobiVet Specialty Surgery to really deliver that, personable access to a specialty surgeon. I come to your practice.
You're gonna do surgery.
I can do surgery in the practice. Mm-hmm. if there's the appropriate equipment and everything like that.
Right.
But I'll bring in some things and want to be able to provide mutual benefits to the community. So, a lot of the referral partners may be more inclined to keep patients in house, but it's like, hey, I need to get a TPLO done,
Right.
and like, well, I can come in and provide that care while you're benefiting from keeping the patient in house, but also I'm able to provide care for the pet. The pet's being cared for.
You probably see a lot of pet owners
Mhm.
that go with the animal, but there's an
Mhm.
affordability issue.
Yeah.
What do you think about that?
It can be really challenging, especially in the climate of our economic times. And if it were up to me, I would do surgery at a very low cost. I usually am very honest with owners. So if I think that, hey, they may be able to get a pretty routine procedure like a enucleation, or let's say mass removal or something like that, I'll actually talk to owners like, hey, you may want to connect with one of the local veterinary partners in the community and see if they can sign you up for that. I'm more than happy to give my input and opinion, but it's challenging. So with insurance, that's definitely out there. That's helped. The pet insurance, so companies like Trupanion, I know even the major brands of insurance like Allstate, Progressive, I think now it's like pet policies that you can get, and they're usually very affordable. So at least within the last 10-15 years, you're looking around like $60 to maybe $120 a month for pet insurance, and they cover differing aspects of treatment. So it's a win-win-win all around.
Great. So thank you, Dr. McCarthy. That was actually like, you taught me a lot.
Oh, really?
That's stuff I didn't know. But this Sunday, we're going to have our CE. We're going to start at 7. And please tell your colleagues about the JVMS. For $75 a month, you're going to get CE. You're going to get business meetings and social meetings. So we want to get more veterinarians into our club. So thank you very much, and we'll see you next time.